Good morning, guys, and welcome to Unique Not Different. Last week, Thursday, the 27th, we celebrated World Occupational Therapy Day. And today, I have Priya Gomes-Mora, who is an occupational therapist here in Trinidad and Tobago, to talk about occupational therapy and what challenges we have in Trinidad and Tobago in terms of access to occupational therapy. So, good morning, Priya. How are you doing?
I am fine. Morning, Shamla, and morning, Trinidad and Tobago. And thank you so much for having me on your program. It's been a while.
Yes, it's definitely been a while, and it is a pleasure to have you, Priya.
Thank
So,
you.
a lot of people still do not know what is occupational therapy. So, what is occupational therapy? Just summarizing, and exactly who benefit or who can benefit from occupational therapy.
Okay. So, well, occupational therapy is a allied healthcare profession. We work with from babies from birth to hospice care, right, in different environments. So we work with persons who have various disabilities or injuries, whether it's neurological, like a stroke, orthopedic, a fractured wrist or a hip replacement, persons with mental health disorders. So we work across the age spectrum. Children, a child's job, and a lot of people get confused with the name occupation, but it really has to do with everything that occupies your time. So a child's occupation is to learn and play, which means being able to sit in a class, take notes, follow orders. Play would include gross motor play like hopscotch, rounders, to fine motor activities, scooch, pitch, etc. As an adult with an injury, your occupations are broken down into three areas: activities of daily living, for example, bathing, dressing, toileting, then your actual work activities, what you get paid for, and leisure activities. So if you have any injury or illness that affects your ability to participate in those activities or occupations, that's where we come in. So we can work in school settings, inpatient hospitals, outpatient. We can work with architects to build or to design structures that are accessible, whether it's wheelchairs, bathrooms, accessible. So there isn't an area that an occupational therapist cannot be a
Yeah,
benefit to.
it's a broad spectrum. So,
It is. It
right.
is.
So, speaking about that, in terms of demand and supply, is there a sufficient amount of occupational therapists available in Trinidad, especially in the public sector, and also working with in terms of trying to, work with architect in terms of
Right.
building, etc.
No, so unfortunately, we don't. I mean, I returned to Trinidad and Tobago in 2009, and there were an average of between 5 to 10 OTs at any given period. And that kind of dwindled over the years because some of the therapists were from the UK or US, and they went back home. But in the last 4 years, or three to 4 years, the University of Southern Caribbean has developed a master's degree in occupational therapy, and they have already graduated, I believe, 3 cohorts. So we do have about 30 plus occupational therapists licensed and registered to practice in Trinidad and Tobago. However, that number is nowhere near the supply that is needed. You know, if you think about school-based children, if you think about adults with various injuries, non-communicable diseases, diabetes, strokes, etc. We definitely have a part to play, and it's unfortunate that we are not seeing those numbers reflected, especially in the public system. As far as I know, Scarborough Hospital, St. Anne's Hospital has occupational therapy. I believe there was an occupational therapist at San Fernando. I'm not sure if that post is still available, but we have citizens graduating, ready to work, ready to put their knowledge and education into practice. And unfortunately, citizens of Trinidad and Tobago are losing them to the private sector because we don't have positions open and available in the public sector.
Talking about that, right? Yes, it have available in the private sector, but remember these things cost money, right? So, in terms of insurance coverage, does insurance recognize or properly recognize therapy such as occupational therapy?
I mean, I know we're supposed to be selling occupational therapy, celebrating, but Shamla, you're hitting on some points that are very near and dear to my heart, and the struggle that I have been facing since 2009 and the occupational therapists prior to me have been facing. Unfortunately, we're getting a bit of a runaround with the insurance companies. Only a few of them reimburse for occupational therapy. They reimburse for physical therapy because that is the more common therapy that is known, right? But we have occupational therapy, physical therapy, and speech therapy are all separate and apart and unneeded, right? And so what we get is that we get referrals from doctors for a client to come by me for occupational therapy. I tell them, just they want to use insurance. Please check your insurance because it is expensive. And so if you can get back anything from your insurance, it is going to be beneficial to you. And many a time the insurance company does not cover occupational therapy, and they either will decide to go out of pocket to pay me, or they will decide to go to the physical therapist because that's who the insurance company is saying that they will reimburse. Now, there are some injuries and illnesses that both PT or occupational therapy could treat, but then there are some that it really should be the occupational therapist or it really should be the physical therapist. So, insurance is saying that the medical board needs to make occupational therapy more of a standard practice. But we are getting those referrals from the doctors, but we're not seeing that circle closing off where it's coming back to the insurance companies and clients are getting the actual professional that is better suited for them.
And in order to make it a standard practice, you have to have the opportunity to practice it and have vacancies for you to enroll to have it as a standard.
That's one, and it needs to be a standard referral from medical doctors. But luckily, the president of the Trinidad and Tobago Occupational Therapy Association, Ms. Kamara Lani Taradat, did have an opportunity to speak to the Northwest region of the Medical Board Association, I believe. And so she was able to explain really the difference between occupational therapy and physical therapy. And they're very interested in having her present at their AGM. So hopefully we can get a little bit more buy-in from the doctors as to really the difference and when you should refer to each. And hopefully that will trickle down into the insurance companies as well.
How do you reach out to DTOTA?
So you can check them on Facebook, right? Trinidad and Tobago Occupational Therapy Association, or website www.ttota.org, right? They're on Instagram, on Facebook. October was Occupational Therapy Month, so they were very busy doing activities. They hosted a health fair up this past Sunday. We were fortunate to send one of the members to Paris for the World Federation of Occupational Therapy conference, right? And then various members have been putting on and presenting at various conferences. The president had the opportunity to present at the 10th anniversary of the Down Syndrome Family Network Conference. So, we're still partnering strategically with disability groups and various ministries, but we need to push this a little bit more for citizens to really understand the benefits of occupational therapy and to advocate for those services for themselves, their children, their elderly parents, etc.
Priya, I want to say thank you so much for coming.
Thank you so much for having me.
Yes, I'm going to be behind it and write out, tell Priya, I love she, quote unquote. Good. So thank you.
Thank you, mommy.
Tell Priya, thank you so much. This was, really, I hope it shed some light in terms of the gaps there is catering for, occupational therapists in Trinidad and Tobago. So once again, thank you. It's always a pleasure.
Thank you. Always a pleasure explaining OT and getting our information out there. Have a beautiful day, Trinidad and Tobago.
To you, thank you. And as I always say, guys, be good, do good. Until next week. Bye, guys. Bye, Priya.
Bye, Shamla.
Bye.